Section 1. Why LBD is so different. When people hear the word dementia, they usually think of memory loss. But Lewy Body Dementia plays by completely different rules. Lewy Body Dementia, or LBD, is one of the most complex and misunderstood brain diseases. Why? Because it doesn't affect just one system, it attacks many at once. Unlike Alzheimer's, where memory loss often comes first, LBD strikes attention, perception, movement, sleep, and behavior, all together. It's like Alzheimer's, Parkinson's, and a psychiatric disorder combined. People with LBD may see things that aren't there, vivid visual hallucinations of people or animals. They may be alert and sharp one moment, then suddenly confused or drowsy the next. This dramatic fluctuation can happen within hours. Movement is also affected. Slowness, stiffness, tremors, and balance problems appear, similar to Parkinson's disease. And at night, the brain loses its safety switch. People with LBD often physically act out their dreams, kicking, shouting, even falling out of bed. This is called REM sleep behavior disorder, and it's one of LBD's earliest warning signs. So what's causing all this? Deep inside the brain, abnormal protein clumps called Lewy bodies disrupt vital brain chemicals. They damage dopamine, affecting movement, and acetylcholine, affecting thinking, attention, and perception. Even the autonomic nervous system is involved, leading to dizziness, blood pressure drops, constipation, and sweating problems. That's why LBD feels chaotic, unpredictable, overwhelming. Symptoms don't arrive one by one, they collide. And to make it even more dangerous, people with LBD are extremely sensitive to common antipsychotic medications, which can cause severe or even life-threatening reactions. This is not just another dementia. Lewy Body Dementia is a unique multi-system brain disorder, one that challenges diagnosis, treatment, and understanding. And this is only the beginning. Section 2. The unpredictable symptoms. One of the most difficult aspects of Lewy Body Dementia is unpredictability. Symptoms can change within minutes or hours. A person may be clear and focused, then suddenly confused, drowsy, or disoriented. Vivid visual hallucinations are common, often seeing people or animals that aren't there. Movement may slow, muscles stiffen, balance fails, leading to falls like in Parkinson's disease. Sleep offers no relief. Many physically act out their dreams, feel extreme daytime sleepiness, or struggle with insomnia. LBD also disrupts the body's automatic systems, causing blood pressure drops, severe constipation, temperature problems, and bladder issues. Add mood changes like depression, anxiety, agitation, or apathy, and even simple tasks become overwhelming. That's what makes LBD so unpredictable. Every person experiences a different mix at a different pace, making Lewy Body Dementia one of the most complex dementias to manage. Section 3. Why it's so misdiagnosed. Lewy Body Dementia is one of the most frequently misdiagnosed brain diseases. Why? Because its symptoms overlap with other conditions. Early changes in thinking, judgment, and behavior can look like Alzheimer's. Movement problems often resemble Parkinson's disease, and vivid hallucinations may even be mistaken for a psychiatric disorder. Unlike other dementias, memory loss may not appear early, confusing doctors who rely on traditional diagnostic criteria. There's another problem. There is no single test to confirm LBD during life. Diagnosis is based on clinical signs and medical history, and certainty often comes only after death. Despite being the second most common progressive dementia, LBD is still poorly recognized, especially outside specialist care (MO), and it may be missed more often in women. As a result, diagnosis can take over 18 months and multiple doctor visits. This delay matters. Some medications commonly prescribed for sleep, mood, or psychosis can cause severe and dangerous reactions in people with LBD. Early and accurate diagnosis isn't optional, it's critical. Section 4. How it changes the brain. Lewy Body Dementia doesn't just affect behavior, it physically changes the brain. Inside brain cells, abnormal protein clumps called Lewy bodies begin to form. These clumps, made of alpha-synuclein, disrupt how neurons work and eventually cause them to die. As brain cells fail, critical neurotransmitters are thrown off balance, chemicals responsible for thinking, alertness, movement, mood, and sleep. This damage explains the symptoms we see: unpredictable attention, vivid visual hallucinations, Parkinson-like movement problems, and acting out dreams during sleep. Over time, these brain changes spread, causing confusion, mood shifts, anxiety, depression, and agitation. Because LBD affects brain areas also involved in Alzheimer's and Parkinson's, its symptoms often overlap, making diagnosis especially difficult. Section 5. Managing the condition. There is no cure. But with the right medications, therapy, supportive environments, and care, people with LBD can still maintain quality of life. Understanding how LBD changes the brain is the first step toward better care. There is no cure for Lewy body dementia, but it can be managed. Care focuses on reducing symptoms and protecting quality of life. Medications may help with hallucinations, movement, mood, and sleep, but they must be used with extreme caution, as people with LBD are highly sensitive to many drugs. Therapies play a critical role. Physical therapy helps with balance and movement. Occupational therapy supports daily independence. Speech therapy addresses voice and swallowing problems. Simple lifestyle adjustments matter. Quiet environments, reduced clutter, clear routines, and avoiding overstimulation. Caregivers are essential. Reassurance works better than correction. Consistency reduces confusion, and support groups help no one feel alone. Managing LBD is about teamwork. With the right medical care, therapy, environment, and support, people living with LBD can still experience dignity, safety, and quality of life. Section 6. Hope and awareness. Lewy body dementia is challenging, unpredictable, and often misunderstood. But there is hope. Early awareness, accurate diagnosis, and supportive care can make a real difference. Caregivers, families, and medical teams working together help people with LBD live with dignity, safety, and quality of life. Every small adjustment, every patient-centered therapy, every moment of patience and understanding creates comfort and hope. If you or someone you love is facing LBD, know this: you are not alone. Support, education, and compassionate care can light the way forward. Thank you for watching. Let's raise awareness. If this video touched you, share this video with someone you love. And remember, knowledge can save families and the ones we love most. Together we can bring hope and improve lives for everyone affected by LBD. Because even in the face of Lewy body dementia, hope is stronger than fear. Stay informed, don't miss out, hit subscribe. Like, comment, and share only on this channel.